I'm back today with Whitney Maynard Rao. And Whitney, you're part of the Millard Maynards, right?
We are.
Tell me a little bit about who your mom and dad are.
My mom is Judy Maynard. She was Judy Bartley. She's from Hillier, so she's local. And my dad is Richard Maynard from Johns Creek. And they met at Pikeville College, so I'm half Hellcat and half Bearcat. That probably explains a lot. They taught at Millard, and my dad was assistant principal at Millard and coach at Millard at what was the high school. And my mom taught English there for years and years in the junior high.
Was there ever any doubt that you would come back here after you finished school?
You know, I think we were just kind of trying to seek God's will for our life and see what His plan was. And I actually had a really good job when I was in Lexington and loved it. And we just felt like God was calling us to be here and be close to family and open this clinic. And everything kind of fell in place. And we've been back here about 4 years now and are really happy to be raising our family here.
Well, we've got Meatloaf with us again. Tell me a little bit about what someone can expect when they bring their dog in for a well animal checkup.
So if we're seeing Meatloaf for the first time, he's going to get an exam from the tip of his nose to the tip of his tail. And when we do that, we're going to check his teeth and his mucous membranes, make sure he's nice and pink and well hydrated. You know, look for any kind of obvious infection or anything in the mouth. The color of his gums can tell us if we are suspicious he might have parasites. We can check for dehydration there as well. Checking ears for infection, things that could be contagious to his brother, like ear mites or anything like that. We're always checking lymph nodes. He still has a resolving skin condition, so he still looks a little rough. We're working on that right now, but he's one of our rescue puppies, so he's here still under treatment for that. We're going to listen to the heart and the lungs. We're going to palpate the abdomen. We're going to check all the business district, make sure everything's okay there. On new puppies, we're going to recommend checking a fecal check for parasites and things like that. And depending on the age, we'll go ahead and start vaccines when they're this age too.
He doesn't seem to mind this at all. It's basically kind of getting a little massage while you do the exam.
Exactly, and that's something we really try to do. Our technicians are very good about that. We want to make it playtime. We want to make it massage. We go through lots of puppy dog treats and things like that. We have lots of squeaky toys and all that, and we want it to not be a fearful experience for them.
Usually the first time someone brings their pet in, is it also for immunizations?
Very often, and that's something that we like to talk to people about because we see a lot of parvo in this area. We're starting to see a resurgence of distemper in this area. Lepto is something that we routinely vaccinate for. That's potentially contagious to people. So there are lots of important reasons to vaccinate your dogs. Same with cats. We had a big panleukopenia outbreak last year that was pretty damaging to the pet population in this area, and so lots of that is preventable with proper vaccines. But we like to talk to people about how that means a series of vaccinations, not just one time, and things like that.
So booster shots?
Exactly. Ideally, we would start with 6, 9, 12, and 16 weeks with him, and at 16 weeks he would get rabies vaccine and be good for a year after that. But we do recommend annual boosting of those vaccinations.
I think Meatloaf likes being on camera.
I think he does
Maybe
too.
A star in the making.
He's a star.
One thing I don't know that a lot of people realize is their teeth, their dog's dental health care, how important that is, and what other problems poor dental health can lead to. Tell me a little bit about that.
We saw a dog this morning that had just terrible dental disease, and he was an older patient by the time we saw him and too old to have his teeth worked on very much. So for him, we're talking about comfort and infection control, and so it would have been ideal to see him a long time ago and get those teeth cleaned up. We have another dog that we're working on today that's going to feel a whole lot better once we get those teeth scaled and polished. And the vast majority of pets over the age of 2 to 3 are going to have some dental disease. So we always check for that, and it is very treatable, especially if you catch it early and when the pet's still in good health.
So that's something you don't want to overlook, because from what I understand, poor dental health can lead to other
Exactly.
other
We
problems.
can see infections spread to the heart and cause heart disease. It can go to the kidneys, can go to the liver, things like that. But if you intervene early, we can prevent that.
Well, the same way we take ourselves to the dentist and we take our children to the dentist, don't forget your pet's dental health as well.
Exactly.
Well, thanks, Whitney, and thank you, Meatloaf.
Thank you.